Hi, this is Steven, and you are about to begin a study of the human body and how it is organized and how it functions. Okay, for us to understand how it happens when the body is injured, when it is diseased, or placed under stress, and you must know how it is being put together and how its different parts work. Okay, just an auto mechanic that must be familiar with the details of the structure and the functions of a car, or a healthcare professionals and those who work in human performance in care professionals must have an intimate knowledge of the structures and functions of the human body, and this knowledge will be one of the most effective tools. And much of what you study in this chapter will help you understand how anatomists visualize the body. And the vocabulary presented here will help you also describe the body in a language common to scientists and professionals. This is an introduction to the human body. Did you ever wonder why an autopsy is performed? And the image on your left side is a brain autopsy demonstrating the signs of meningitis. The forceps in the center are retracting the dura mater, which is in white, and underneath the dura mater are the leptomeninges, which appear to be edematous and have multiple small hemorrhagic foci. We will learn all of these structures and the basics of your human brain in the later chapters. So you will also answer this question, why an autopsy is performed, within the following slides. In the chapter contents, here are the following parts of this lecture. Anatomy defined. We have the levels of the body organization and body systems. We have life processes, basic anatomical terminology. It includes here anatomical position, regional names, planes and sections. We have also body cavities, the thoracic and abdominal cavity membranes. You have abdominal pelvic regions in quadrants, the human body and diseases, aging, and medical imaging. In the first part of these chapters, we will talk about anatomy, and we will define what is anatomy, and also physiology, and we have to name several branches of anatomy. In this table, you will see different selected branches of anatomy. We have embryology, which is the study of, in humans, the first 8 weeks of development after the fertilization of the egg. If you can still remember your fertilization process, the sperm meets the egg. Okay, and this embryology is the study of the first developmental 8 weeks of the fertilized egg. We call it the zygote. In developmental biology, we have here the complete developmental history of an individual from fertilization up until death, okay, or senescence. In cell biology, we'll learn the structure of the cells and its functions. Histology, the microscopic structure of the tissues. In sectional anatomy, it's internal structure and relationships of the body through the use of sections. So here we are classifying here the sections, okay, internal structure and its relationships to the body. Your gross anatomy is the structures that can be examined without using a microscope. So this is the macro level. Systemic anatomy is a structure of specific systems of the body, which is focused on, let's say, for example, nervous or cardiovascular systems, respiratory systems. So that those are for systemic anatomy. Regional anatomy, it's more on the specific regions of the body, such as the head and neck, okay, or chest, etc. Surface anatomy, which looking at the surface markings of your body in order for us to understand the relationship of deep or internal anatomy through visualization, okay, and palpitation. So this is more likely to use your sense of touch or gentle touch for your patients. imaging anatomy, which we will look at internal body structures, which could be visualized with x-rays, CT scans, MRIs, and the like. And lastly, your pathological anatomy from the first word itself. It's talking about the diseases, and we are looking at the structural changes from gross to microscopic, and which it's associated with diseases. Before we move on to the next part, we will be looking at the clinical connection and how this anatomy definition is being performed in the clinic or in hospitals, or the techniques that are being done by your physician. These are what we call as your non-invasive diagnostic techniques. And this one does not involve the penetration or insertion of certain instruments or devices through your skin or into a body opening. So we have these few examples in this slide. The first one is inspection of your oral or mouth cavity. Next would be a palpation of your lymph nodes in the neck. This is also used in the hospital setting. Auscultation of lungs using the stethoscope. You have to also know the different points. Okay, and lastly, here is palpation. We have here different questions that are being answered by the end of this presentation. The first question, which branches of anatomy would be used when dissecting a cadaver? And second, give several examples of connections between structure and the functions of the human body. Make your answers concise. Okay. By the end of this lesson, and we will be going back to this section during the review. We will be also looking at the levels of body organization and body systems. This is just a review. Now, we will describe the levels of structural organizations that make up the human body. And we have to outline the 11 systems of the human body. We will list also the organs present in each and explain their general functions. In this figure, you will see here the levels of structural organization, which goes along with the chemical level, cellular level, tissue level, organ level, system level, and organismal level. So from your atoms, okay, like your carbon, hydrogen, oxygen, nitrogen, and phosphorus, we will be looking at it will be comprising the molecular your DNA, and your DNA is found inside your smooth muscle cell. Then your smooth muscle cell will comprise the smooth muscle tissue, which is involuntary, as it is flattened. Okay, and then it is also found in this what we call as your smooth muscle tissue layers in the organ in your stomach. Then it is found inside or within your digestive system, together with all of the digestive organs here, and that comprises your organism. Okay, now in this guide questions, you will be answering this one after a pause. Okay, you will be trying to brainstorm. The question goes like this: which level of structural organization is composed of two or more different types of tissues that work together to perform a specific function? You're right. Organs are composed of two or more different types of tissues that work together to perform a specific function. Here are some of the 11 systems of the human body. So the first one is, we will just have a run through all of this. In your integumentary system, the first image, this lady over here in the lower left portion. Okay, the components of your integumentary system are very good, the skin, which is found in your the largest organ, external organ. Also the same with your hair, your fingernails, your toenails, your sweat glands, your oil glands, and your subcutaneous layer. And what are the functions of the integumentary system? Again, some of the functions will be protecting the body from harmful UV rays from the sun. It regulates your body temperature, and it is helping us to create or synthesize your vitamin D. On the middle, we have here the skeletal system, which is composed of the bones, the joints, and their associated cartilage. Okay, what are the functions of these skeletal system? It supports and creates your body a framework, and it also provides a surface area for muscles, attachments, and you're helping you to move. Okay, it aids your body movements, and it houses the cells that produces the blood cells, which will be storing minerals and fats, or what we call as your lipids. Your muscular system is composed of this skeletal muscle and tendons. It's also helping you to move. Okay, now we're looking at the next three systems. The first would be your cardiovascular system, and it's composed of your blood, heart, and the blood vessels. Your heart pumps blood through blood vessels, and these blood will carry out oxygen and nutrients to your cells, and also remove the carbon dioxide away from the cells, and also helping us to regulate your acid and base balance. Okay, the same thing with temperature. It regulates the temperature. Same thing with your integumentary system and the water content of your body fluids. The blood components of these will be helping us defend against the diseases and repair some of the damaged blood vessels. Next would be your lymphatic system or immunity system. Your lymphatic fluid, your lymphatic vessels, your spleen, your thymus, lymph nodes, and tonsils, these are the components of your lymphatic system. It's the cells which will be carrying out your immune responses, for example, B cells and T cells and the others. What are the functions? It returns the proteins and the fluid to the blood. Again, it carries the lipids from the gastrointestinal tract to the blood, and contains sites of maturations and the proliferations of your B cells and T cells that are protecting us against the microbes or disease-causing microbes. Your nervous system is composed of your brain, the spinal cord, and the nerves, and it also contains the special sense organs such as the eyes, ears, your sense of taste and touch, etc. The functions would be to generate the action potentials from the nerve impulses to regulate the body activities. Also detecting the changes in body's internal and external environments, and interprets these changes and responding to the muscular contraction, like say, or glandular secretions when you are scared, or where you are anxious, or when you are threatened by a dog chasing you, running after you. This is your nervous system acting upon it. Your endocrine system is composed of these hormone-producing glands, pineal glands, hypothalamus, pituitary gland, thymus, etc. The same thing with the nervous system. Okay, it targets the responses of your body. It regulates body activities by releasing the chemicals or the hormones, which are referred to as the messengers. Okay, which is transported in blood from an endocrine gland or tissue to a target organ. In this example, you've seen here the testes for the males and the ovaries for the females. Your respiratory system composed of your lungs, some of the air passages, and such as the pharynx, which is also known as the throat, your larynx, which is your voice box, your trachea, which is your windpipe, and some of the bronchial tubes within the lungs. What are the functions? It transfers the O2 from the inhaled air to the blood, and carbon dioxide from blood to your exhaled air. It also helps to regulate the acid-base balance of your body and flowing out of the lungs through the vocal cords, which is producing sounds. Digestive system is composed of these particular parts: your salivary glands, mouth, pharynx, esophagus, liver, and the intestines. Also, this the rectum and the anus. They are achieving the physical and chemical breakdown of food, which will be absorbed, okay, and being used up by the body, and also eliminate solid wastes. And the last three systems, your urinary system, the kidneys, the ureter, urinary bladder, the urethra, will be producing and stores and eliminates the fluid, the waste fluid, we call it the urine, and eliminate the waste and regulates the volume, composition, and chemical of your blood, and also help to maintain the acid-base balance of your body fluids and the mineral balance. It also help to produce the red blood cells. Your reproductive systems will be separate for male and female. The gonads, it's called testes in males and ovaries in females, and associated organs, which is the uterine for the fallopian tubes, uterus, and vagina for the females. Epididymis, seminal vesicles, prostate ductus, deferences, and penis in males. What are the functions of these reproductive systems? It is helping us to produce the gametes. It's either the sperm or your oocytes, and unite to form a new organism. Also, gonads are releasing some of the hormones that regulates the reproduction and other body processes and associated organs. Let's say in females, it's the progesterone and your estrogen, which also helps the bone calcium regulation. Now we will have a checkpoint, and this third question: define the following terms: atom, molecule, cell, tissue, organ, system, and organism. And which body systems help eliminate waste? There's a hint. You may refer it to the table 1.2. Now we're moving on to the life processes. And we have to define some of the important life processes in humans. We have the first two. First would be your metabolism. Okay, it is defined as the sum of all the chemical processes that occurs or happens inside your body. It could either be anabolism or catabolism. You know that in your biochemistry, it includes the breakdown of large complex molecules into smaller, simpler ones, and building up of a complex molecule from simpler and smaller ones. Next would be responsiveness, is your body's ability to detect and respond to the changes in your environment. For example, your nerve cells, it responds to changes in the environment by generating some of the electrical signals, and we know them as your nerve impulses. Muscle cells also respond to this nerve impulses by contracting, generating force, and to moving body parts. The same thing with your glands. Okay, your endocrine system also acts upon it by releasing hormones to the target organs. Movement, it includes the motion or the moving of your entire body. Individual organs, even single cells, and even tiny organelles inside the cells are moving. Growth is also an increase in your body size. It may be also due to an increase in first the size of existing cells, the number of cells, or the amount of material surrounding cells. So we are called a multicellular organism because that's comprising of different types of cells that comprises different types of tissues and different types of tissues inside an organ. Differentiation is a process wherein unspecialized cells become specialized cells, and these are true in your stem cells. They specialize. Okay, although these specialized cells differ in structure and function, and from the unspecialized cells that gave rise to them. For example, your single fertilized egg undergoes like a lot of differentiation to develop into a unique individual which is similar to yet quite different from either of the parents. That's fertilization process. Okay? It's the blending of the characters from the paternal side and the maternal side. Blending. Okay? Shuffling of traits. In genetics, you also learned that one. Next would be your reproduction. It's either to form a new cells for like growth or repair or replacement, or it could either be production of a new entire individual. So that's next checkpoint here. What are the meanings or different meanings for growth? Now we're talking about your basic anatomical terminology, and some of the learning objectives of this section will be to describe the orientation of your human body in the anatomical position. Also relate some of the common names to the corresponding anatomical descriptive terms for some of the various regions of your body. And we have to define your anatomical planes, anatomical sections, and some of the directional terms which are used to describe the human body. And this is some of the basic anatomical terminologies. This woman here in anterior view, and the right image will be the posterior view. This lady here is in anatomical position. This is the anatomical position. The subject stands erect, facing the observer with the head level and their eyes facing forward. Look at their eyes. The lower limbs are parallel and the feet are flat on the floor and directed forward. The upper limbs are at the sides with their palms facing forward. Here we have your cephalic region, your head. It includes the cranial and the facial. Your cervical, which is your neck. Your axillary, brachial, antecubital, antebrachial, your carpal, palmar, digital or the phalangeal for the fingers. Okay. We have also the femoral for your thigh because of the bone found here, the femur. The patellar region, the anterior surface of the knee. The crural region for the leg. Now in your foot, which is your pedal part, so this is the pedal here. The word pedal, like if you heard the word pedestal or pedestrian, pedicab, it's the pedal. The ped refers to the foot. Now tarsal for ankle, or digital or the phalangeal for your toes. Next would be this part, the frontal, the forehead, the temporal, the temple orbital for your, or ocular for your eye, otic, ear, buccal, nasal, oral, mental. In your thoracic region, your chest, you have your sternal, the breastbone, which is this bone, the flat bone found in the middle part. Mammary glands for the breast, mammary, abdomen, also your trunk. We have here your umbilical, the navel, the coxal, the inguinal or the groin region now found in your pelvic part. Your thumb, your manual. Okay, manual refers to the hand. When you hear the word manuscript, manicure, manipulate, and here the pubis, dorsum, and the hallux. Moving at the back or the posterior view, we have here occipital, or the base of your skull. Also, we can find here the occipital lobes. Okay, your scapular or the shoulder blades, we refer to the scapula, the bones. The vertebral or the spinal column, Now the olecranal or cubital, which is back of your elbow. The sacral, it's between your hips. Lumbar, your loin, because of the spinal column. Okay, lumbar region. The gluteal, the glutes. These muscles are for your buttocks. Perineal region, or your anus and your external genitals. Popliteal, which is hollow behind your knee. Sural, which will be your calf. Plantar for your sole, and your calcaneal for your heels. Dorsum for the back of your hand. Again, this is your anatomical position. Our next question, guide question, is this: why is it important to define a one and single standard anatomical position? You're right. Having one standard or single anatomical position, it allows us to the directional terms to be clearly defined. Okay, so that any body part can be best described in relation to any other part, and we will learn that one in the future slides. Now we're moving into your planes, and in your anatomical position, planes are some of the imaginary flat surface that passing through the body. The first one is your mid-sagittal plane. It's a vertical plane that passes through the midline. It divides your body into its left and equal left and right sides. Okay, it's found in the midline because there's a midline in the middle, and it's also called your mid-sagittal plane, and or your medial plane. Your next would be parasagittal plane. Your parasagittal plane, it's because para, which means beside, and sagittal, which means arrow. Okay, this parasagittal plane is dividing the body into the unequal left and right sides. Your frontal plane here, the frontal plane, okay, or also call it as your coronal plane, is dividing the body or the organ into the front and its back position. Your transverse plane is dividing the body or an organ into its upper and lower portions. Okay. Also, transverse plane will be also termed as your cross-sectional plane or horizontal plane. Sagittal, parasagittal, and transverse planes are at all right angles to one another, and an oblique plane, okay, by contrast, in the last one, is passing through the body or an organ into an oblique angle, and this is any angle other than 90 degrees. Your next question here, as a guide question: which plane divides the heart into its anterior and posterior positions? You're right. It's the frontal plane. Okay? The frontal plane is dividing the heart into its anterior and posterior positions. Now we will be looking at the basic anatomical terminologies, okay, into the planes and sections through different parts of your brain. So in the diagrams, okay, it shows here the planes, and the photos on the right, which will be the resulting sections. Okay, note that these view arrows in the diagrams include the direction from which each section is being viewed, and this is aid. Okay, it's helping us throughout this book or the chapter to indicate this viewing perspective. We have here mid-sagittal plane and its view, okay, in the brain. Frontal plane, okay, the front and back portions. And lastly, we have here the transverse plane, which divides the brain into its top and bottom positions. Now we're moving ahead with the next guide question. Which plane divides the brain into unequal right and left sides? You're right. It's the parasagittal plane. It divides the brain into its unequal right and left sides. Questions for our checkpoint. Now we will describe your anatomical position and explain why it is used. Locate each region shown in figure 1.2 on your own body and then identify it by its anatomical position, its descriptive form, and corresponding common names. Which of the planes that divide the body are vertical, and what is the difference between a plane and a section? Now we were moving ahead with the directional terms. We have to define each of the directional terms which is used to describe the human body. Directional terms for the superior, okay? When you say superior, it's above or higher in position towards your head, okay? It is not used in reference to your limbs. For example, the heart is above the liver. The heart is superior to the liver. Cranial, or we call it cephalic. It's relating to the skull or head or towards the head. It's more flexible term than superior because it can be applied to all animals, whether they stand upright on two limbs or in all four limbs. Let's say their stomach is more cranial than the urinary bladder. Inferior, it's in low position towards your feet, and it's not used to in reference to the limbs. Okay, your stomach is inferior to the lungs. Rostral, it's relating to the nose and mouth region toward the face. It's used only in references within your head. Okay, the frontal lobe of your brain is rostral to the occipital lobe. Next would be your caudal. It's relating to your tail. Okay, the caudal or the tailbone, or near the tail or posterior part of your body, and it's used only in references within the trunk. Let's say the lumbar vertebrae are caudal to the cervical vertebrae, the vertebra found in your cervical region. Anterior, it's nearer or at the front of your body. Let's say the sternum or your breastbone is anterior to the heart. Posterior, it's nearer to or the back of your body. Let's say the esophagus is posterior or is at the back to your trachea or your windpipe. Ventral, it's relating to the belly side of your body. It's toward the belly. Your intestines are ventral to the vertebral column. Dorsal, it's on the back side of your body and toward the back. Your kidneys are dorsal to your stomach. Medial, it's nearer to the midline. Okay, it's an imaginary vertical line that divides the body into your equal left and right sides. The ulna is medial to the radius. Lateral, the farther from the midline. The lungs, okay, are lateral to the heart. Intermediate is found between the two structures. The transverse colon is intermediate to the ascending and descending colon. Now, directional terms are also used precisely to locate various parts of the body relative to one another. And these arrows here are helpful. Okay, when it's away from the trunk, it's distal. When it's going into the trunk, we call it proximal. When it's on the top of your body, it's superior, and it's inferior below. This is the anterior portion. Okay, when it's in the middle, it's called medial. It's away from the middle, it's called lateral. And we also have ipsilateral. Okay, when it's on the same side of the body as another structure. Let's say the gallbladder and ascending colons are ipsilateral. They are on the same side of the body. Okay. Contralateral, on the opposite side of the body's midline from another structure. Let's say your ascending colons and descending colons are contralateral. Proximal, it's nearer to the limb or the trunk. The humerus or the arm bone is proximal to the radius. And it's distal, it's farther away. Okay, your phalanges or the finger bones are distal to the wrist bones. Phalanges and wrist bones. Superficial, it's toward on the surface of your body. It's going on the surface. Your ribs are superficial to the lungs because the rib cage protects the lungs. Your deep, it's away from the surface of the body. It's more on the inside. The ribs are deep to the skin of the chest and back. Some of the directional terms like external, okay, it's toward the outside of the structure. It's when we describe the relationships of individual organs. Let's say, for example, your visceral pleura is on the external surface of your lungs. When you say internal, it's towards the inside of a structure. It's typically when describing individual organs. Let's say mucosa, okay, the mucosa, the one that's in found in your stomach, forms an internal lining. Now, we have the next set of guide questions for the directional terms. First one, is the radius proximal to the humerus? Is the esophagus anterior to the trachea? Are the ribs superficial to the lungs? Is the urinary bladder medial to the ascending colon? Or is the sternum lateral to the descending colon? Brainstorm your answers. You're right. First, it's no. The radius is distal to the humerus. Second, also no. Your esophagus is posterior to the trachea. Number 3, yes. The ribs are superficial to the lungs. The fourth, it's also yes. The urinary bladder is medial to the ascending colon. And lastly, no, because the sternum is medial to the descending colon. Now, a checkpoint question. Which directional terms can be used to specify the relationships between the elbow and the shoulder, the left and right shoulders, the sternum and the humerus, and the heart and the diaphragm? Check that one out. Now we will be looking at the body cavities. What are the body cavities? We describe the major body cavities, the organs they contain, and their associated linings. What are body cavities? They are spaces within your body that houses or stores your internal organs. It could bones, muscles, and ligaments that are separating the various body cavities from one another. Here we will be discussing several of the body cavities, and they are described with colors. Okay, we have here your cavity and their comments. The cranial cavity formed by the cranial bones, and it also contains your brain. Your vertebral canal, okay, is formed by the vertebral column, and it contains the spinal cord and the beginnings of your spinal nerves. Your blue part, or your thoracic cavity, it's also called the chest cavity. It contains your pleural and your pericardial cavities, and also your mediastinum. Your pleural cavity is surrounding the lung. Each surrounds the lung, and it has a serous membrane of each pleural cavity is what we call as your pleura. Pericardial cavity, it surrounds your heart, and the serous membrane of the pericardial cavity is your pericardium. Mediastinum is the central portion of your thoracic cavity between your lungs, and it extends from your sternum to vertebral column, and from first rib to diaphragm, which will contains the heart, your thymus, esophagus, the trachea, and several large blood vessels. Your abdominal pelvic cavity in green are subdivided into your abdominal and pelvic cavities. Your abdominal cavity, again, it contains your stomach, spleen, liver, gallbladder, and most of your large intestines, small intestines, and the serous membrane found here is your peritoneum. Your pelvic cavity, it's containing the urinary bladder, the some portion of your intestines, internal organs, and again, this body here, okay, your body cavities, indicates the border between the dashed lines here is placing the border between your abdominal and pelvic cavities. Now, this is your photographs, okay, dissection by Sean Miller. This is the brain and cranial cavity, spinal cord in the vertebral canal, and this is your vertebral column. This is heart in your thoracic cavity, the liver and the intestines in your abdominal cavity, and the urinary bladder in the pelvic cavity. In the anterior view, you'll see the lungs, heart, your diaphragm, liver, intestines, the thoracic, and your abdominal pelvic cavities. There's a guide question. In which cavities are the following organs located? Urinary bladder, stomach, heart, small intestines, lungs, internal female reproductive organs, thymus, spleen, and liver. Use the following symbols for your responses. We have your T for thoracic cavity, A for abdominal cavity, or P for pelvic cavity. You're right. For urinary bladder, it's P. For stomach, it's A. Heart, it's T. Small intestine, A. Lungs, T. Internal female reproductive organs, P. Thymus, T. Spleen, A. And lastly, liver, A. Very good. Now we are looking at your anatomical body cavities. For anatomical position is front. Okay, the thoracic cavity here are the black dashed lines in A and the next portion in B, which is describing the borders of your mediastinum. Note that the pericardium surrounds the heart and that the pleura surrounds the lungs. Okay, you will notice here this pericardial cavity in orange, the parietal pericardium, and the visceral pericardium are all part of or surrounding the heart. Call it the pericardium. The pleura, okay, that refers to the lungs, the right pleural cavity in purple, the parietal pleura outside, the visceral pleura inside, and the muscle, the diaphragm, which is helping in inhalation and exhalation process. So, the transverse portions are also shown in the next images, and they are also viewed inferiorly from below. This is the inferior view of the section or transverse section of your thoracic cavity. Here is the view that refers to the arrow viewed downside. You have the muscles, your heart, your right lungs, the left lung, your esophagus, your aorta, right pleural cavity, and your rib. Also with your vertebral backbones, your sternum, your breastbone, thymus, and many more. This is more detailed, okay, inferior view of the dissected portion of a transverse section of your thoracic cavity. Here is the sternum, which is the bone, parietal pericardium. This is your pericardial cavity, your visceral pericardium, and the heart. That comprises again the pericardium. Your lungs here, the parietal pleura, the right pleural cavity, visceral pleura, okay, your skin, your right lung, and the rib. Now, this is more of the detailed view of, okay, dissected layers of your pericardium and the pleura. The parietal pericardium, pericardial cavity in the visceral pericardium, your visceral pleura, which is covering the lungs, parietal pleura, which is covering the fibrous pericardium, the parietal pleura, which lining the rib cage, and the pleural cavity. Okay, the lungs is inside the pleural cavity. Parietal pleura is the one that covers your diaphragm, that refers to as the pleura. So what's the concept of a serous sac? Okay, if this is your organ, your fist, the parietal layer is outer wall of your balloon. Okay, when you put your fist inside the balloon, your serous cavity is the amount or the small amount of lubricating serous fluid or the gas inside the balloon. The visceral layer is the inner wall of your balloon, the one that is that touches your skin. That's the visceral layer. Now, in your body cavities, we have a guide question. Which of the following structures are contained in the mediastinum? Right lung, heart, esophagus, spinal cord, trachea, rib, thymus, left pleural cavity. You're right. The structures in the mediastinum include the heart, esophagus, trachea, and the thymus. Question here: what structures separate the various body cavities from one another and describe the contents of your mediastinum? Now, for the abdominal pelvic regions and quadrants, the learning objectives would be your naming and describing the abdominal pelvic regions and your abdominal pelvic quadrants. This is an anterior view showing us the abdominal pelvic regions. Now we have here your bones, your clavicles, the mid-clavicular lines. This is the right and the left. Okay, this is the right hypochondriac region, right lumbar region, and right inguinal region. On the left hypochondriac region, left lumbar region, and your left inguinal region. You can notice this are the lines, okay, that divides your epigastric region and umbilical region. This is what we call as your subcostal lines. Your umbilical region and pubic region is divided by these horizontal lines. We call it the transtubercular lines. To be specific, what are the portions or the organs found in here? This is your anterior view showing the location of the different abdominal pelvic regions. Again, it's because of this 10th costal cartilage. This is your the line, okay, that divides the epigastric and then the umbilical region. It's the edge. Now, these are the superficial view of organs in your abdominal pelvic regions. You can see here the right lobe of your liver, the spleen, the left lobe of the liver, the stomach, transverse colon of your intestine or large intestine, the descending colon of your large intestine, urinary bladders, appendix, your cecum, small intestine, and the ascending colon of your large intestines. Now, there is also a guide question. What abdominal pelvic region is each of the following found? Most of the liver, transverse colon, urinary bladder, and the spleen. You're right. The liver is mostly in your epigastric region. The transverse colon is in the umbilical region. And the urinary bladder is in the hypogastric region. And the spleen is in your left hypochondriac region. This dissection photograph shows you quadrants of your abdominal pelvic cavity, and below the dashed lines here, okay, these two lines here is crossing at a right angle at your umbilicus. This is your navel, okay, they're forming the right angles on your navel, thus giving us the different quadrants: right upper quadrant, right lower quadrant, left upper quadrant, and the left lower quadrant. Next question. In which abdominal pelvic quadrant would the pain from appendicitis or the inflammation of your appendix be felt? You're right. The pain associated with your appendicitis will be felt in your right lower quadrant, or the RLQ. Checkpoint. We have to locate the different abdominal pelvic regions and the abdominal pelvic quadrants on yourself. Which ones contains your spleen, your colon, and your urinary bladder? This is the answer to the question that we had in the first few parts of the slide. Autopsy. Okay? An autopsy or necropsy is a post-mortem or after-death examination of your body and dissection of its internal organ to confirm or to determine the cause of death. This is a very nice photo from the Rembrandt, the anatomy lesson of Dr. Nicolas Stock. Now we're moving ahead with the human body and diseases. It is very relevant nowadays with the emergence of the coronavirus, the COVID-19, and its variants from Alpha to Lambda. Okay. Now the photo on your background shows you a coronavirus infecting a cell. Now we will distinguish between a symptom and a sign of disease, and this is very useful in learning anatomy. What is a disease and what is symptoms and signs? We will be defining first a disorder. When you say disorder, it's an abnormality of a structure and or a function. Let's say eating disorders, mental disorders. A disease is a more specific term for an illness characterized by a recognizable set of symptoms and signs in which body structures and functions are being altered in a very characteristic way. That's a disease. Okay? When I say a person with a disease may experience symptoms, and these symptoms are subjective changes in your body functions which are not apparent to an observer. So technically, that's the more of a subjective. The patient will be feeling headaches or symptoms like nausea and anxiety, and you cannot. These could not be measured by any means by someone who is like looking at you and checking up your sign or your symptoms. Okay. Objective changes that a clinician can observe and measure are what we call as signs. And signs of diseases could either be anatomical or physiological. When you say anatomical, it anatomical sign of a disease, which will refer as like a lesion or organ or tissue damage which will result from an injury or disease. Let's say swelling, okay, a skin rash, okay, an ulcer, a wound, or a tumor. Some of these are the signs, okay, of a disease. When you say physiological signs of disease, that includes fever, high blood pressure, and paralysis. Let's say the patient has, reached a blood pressure of 160 over 120. That's a very high blood pressure, and it's a physiological signs of a disease, or hypertensive. A local disease, which like sinus infection, affects one part or limited region of your body. A systemic disease, for example, a flu, okay, affect the entire body or several parts of it. Say you have your allergic rhinitis, it affects your sinuses, nasal passages. That's that's a local, okay. We call it limited region. And when you say systemic, it affects your body. Let's say COVID-19, the coronavirus. It affects your upper respiratory tract. Okay, and the entire body is affected because your blood is not receiving enough oxygen molecules and the organs are not receiving these O2 molecules. That's why your O2 saturation, when you have being read by your pulse oximeter, goes low because your lungs isn't working properly because of the formation of the swelling, okay, been brought by the coronavirus. Next question for the checkpoint: would you classify each of the following as a sign or a symptom? First, high blood pressure, fever, headache, and rapid pulse. Now we're moving ahead with aging. Aging, and we will describe some of the general anatomical and physiological changes that occur with aging. As you will see later, aging is a normal process. It's characterized by a progressive decline in your body's ability to restore homeostasis and the maintenance of relatively stable conditions. Aging produces some of the observable changes in structure and function, and it increases the vulnerability to stress and diseases. Where the examples are the aging signs: wrinkled skin. You will see your grandparents having a gray hair. Okay, loss of bone mass, decreased muscle mass, strength, diminished reflexes, decreased production of some of the hormones, increased incidence of getting a heart disease, increased susceptibility to infections such as and sometimes cancer, decreased lung capacity, less efficient functioning of your digestive system, and decreased kidney functions. Those are some of the signs of aging. What are some of the signs of aging? The technologies which are being used in medical imaging. In describing the principles of medical imaging and procedures and their importance in the evaluation of organ functions and the diagnosis of diseases. Now, what's medical imaging? Medical imaging refers to the techniques and processes used to create the images of your human body. Various types of medical imaging allow visualization of structures inside our bodies and are being used more and more to increase the precision of diagnosis of a wide range of anatomical and physiological disorders. And we will present here some of the technologies that are being used in the industry. This table will present you common medical imaging procedures. The first would be the common one, which will be your radiography. The procedure is a single barrage of X-ray passes through your body. X-rays, I remember, these are waves. Okay, they produce an image of the interior structures on an X-ray sensitive film, and these resulting into a two-dimensional image, which we call as your radiograph, or commonly called as X-ray. Radiographs are relatively inexpensive. They are very quick and very simple to perform, and they usually provide sufficient info for diagnosis. And they could not easily pass through some of the dense structures in your bones that appear white, and hollow structures such as the lungs, which appear black. Structures of intermediate density such as the skin, fat, and muscle appear as a varying shades of gray. At low doses, X-rays are very useful for examining soft tissues such as the breast, or we call it the mammography or your DEXA scan, and also for determining your bone density or the bone densitometry. Very useful, okay, to use a substance called a contrast medium to make a hollow or fluid filled structures visible and in radiographs. Also X-rays make structures that contain contrast media appear white. The medium may be introduced by injection, orally, or rectally, depending on the structure to be imaged. So these are the following images, okay, of your radiography. Radiograph of your thorax and anterior view, a mammogram of a female breast showing a cancerous tumor. This is the white mass here, and they have having uneven borders. And bone densitometry scan of a lumbar spine in anterior view. Lumbar spine. Contrast x-rays are also used to image blood vessels. We call that one as angiography. And the urinary system, the intravenous urography, and the gastrointestinal tract, or the barium contrast x-ray. These are the photos. And the angiogram of an adult human heart showing a blockage in your coronary artery. In your arrow, you will see here a blockage. Okay, very early symptom of a heart attack. Intravenous urogram showing the kidney stone arrow in your right kidney. Again, your kidney stones are formed by oxalate crystals which are being stuck in your kidney, and it causes making your blood increase its acidity. Okay, making uric acid levels, and a lot of causes that led to the formation of your kidney stones. Barium contrast x-ray showing a cancer of the ascending colon cancer here. Next would be your magnetic resonance imaging, or the MRI. Now, your body is being exposed to a very high energy magnetic field, which causing the protons in body fluids and tissues to arrange themselves in relation to the field. And this pulse of radio waves reading these ion patterns and thus producing a color-coded image assembled in a video monitor. The result of MRIs would be a 2 or 3D blueprint of the cellular chemistry. So it's relatively safe, okay, but comments on it will be it cannot be used with patients with metal in their bodies, like when say they have these pacemakers, okay, that shows fine details for soft tissues but not for bones. Most useful for differentiating between normal and abnormal tissues, and also used to detect tumors and artery clogging fatty plaques, revealing the brain abnormalities, measuring blood flow, detect a variety of musculoskeletal, liver, and kidney disorders. This is an example of an MRI of brain in sagittal section. Again, sagittal defines the body into its very good. It's equal left and right parts. Computed tomography, the CT, also called as a CT scan, or formerly called the computerized axial tomography scanning. This computer-assisted radiography, which an X-ray beam traces an arc at multiple sections around the body. The resulting transverse section of the body is called a CT scan, and it's being shown on a video monitor. Some of the comments here, some of the visualized soft tissues and organs with much more detail than conventional radiographed. Very soft tissues, okay, with differing tissue densities, okay. Not showing is that it shows various shades of gray. It could either be assembled to build a 3D view of structures. Whole body CT scan is used, and typically such scans actually target your torso. Also used for whole body CT scans, most essential, it would benefit patients screening for lung cancers, CIDs, coronary artery diseases, and some of the kidney cancers. This is a tomography or a CT scan of a thorax in inferior view. Next would be your coronary computed tomography angiography. This is more likely to use an iodine containing contrast medium, which are being injected to the vein, and a beta blocker is given to decrease the heart rate. The numerous X-ray beams trace an arc around the heart. The scanner detects the X-ray beams and transmits them to the computer, which transforms the information of a 3D image of the coronary blood vessels in a monitor. The image produced is called a CCTA scan, and it could be generated in less than 20 seconds. Okay. Very effective in determining whether there are coronary artery blockage. Okay. Let's say atherosclerotic plaque or calcium. Okay, which will be requiring such interventions such as your angioplasty or stent. CCTAs also can be rotated and enlarged and move at any angle. And since this procedure can take thousands of images of your heart within the time of a single heartbeat, it's providing a great amount of details about the heart's structure and functions. Now you'll see here a CCTA scan of a coronary artery block and the normal coronary artery. We look at the image; it's deformed, okay, from this portion. Now, ultrasound scanning. This is also more common because we are using high frequency sound waves, which is produced by a handheld wand reflecting off body tissues and detected by the same instrument. It's the image it could be still or moving, and it's called a sonogram. It's being shown on a video monitor. It's safe, non-invasive, painless, and it uses no dyes. So most of the patients are pregnant women are using this one to visualize the fetus during the pregnancy, and also to observe the size and location of organs and blood flow through the blood vessels, which is the Doppler ultrasound. This is your a sonogram of a fetus showing the foreheads, the eyes, and the hand. Next would be your radionuclide scanning. Radionuclide or radioactive substance, it is being introduced intravenously into your body, and it's carried by the blood to the tissue that is being imaged. We use gamma rays, which is emitted by the radionuclide, and they are detected by the gamma camera outside the subject and fed into a computer. And this computer constructs a radionuclide scan and displays it in color into a video monitor. So we have areas of intense color, which is being taken up of a lot of radionuclide and represent high tissue activity, and the less intense color are taking up smaller amounts of the radionuclide and represent low tissue activity. So this is also using the single photon emission computed tomography, or the SPECT scanning, which is a type or specialized type of a radionuclide scanning that is useful for studying the brain, heart, the liver, and the lungs. So some of the activity of a tissue or organs, just as looking for the malignant tumors in body tissues or scars that may interfere with sometimes heart muscle function. In the image on your left, this is a nuclear scan of your normal human liver, and a single photon emission computerized tomography scan of a transverse section of the brain, with the green area at lower left, each indicating a migraine attack. Last two medical imaging procedures is your PET, okay, the positron emission tomography. which is a using a substance that emits positrons. We call it the positively charged particles, which is injected into your body and which is taken up by tissues. This collision of a positron with negatively charged electrons of the body produces the gamma rays, which are very similar to X-rays, and that are detected by the gamma cameras positioned around the subject. Okay, so in your PET scan image shown here, the black and blue colors indicate minimal activity. The red and orange, yellow, and white colors indicate in areas of increasingly greater activity, and you will learn that one when we more deal with a lot of PET scans in the future lessons. Again, this is also used to study the physiology of the body structures, such as the metabolism in the brain or your heart. This is a transverse section of the brain, and circled area on the upper left indicates where a stroke is or has occurred. Last is endoscopy. Okay, endoscopy is a visual examination of inside of the body organs or cavities using a lighted instrument with lenses, and we call them endoscopes. The image viewed through an eyepiece or the endoscope is projected onto a monitor. So examples of endoscopy include colonoscopy, laparoscopy, arthroscopy. Your colonoscopy is examining the interior of your colon, okay, partly the large intestine. Your laparoscopy is the organs within your abdominal pelvic cavity, okay, and arthroscopy is using examining the interior of your joint and usually the knees. And this a photo on your right is an inferior view of a colon as shown by colonoscopy. As we end, we have following checkpoint questions. Which forms of medical imaging would be used to show a blockage in an artery of the heart? Which one of the medical imaging techniques outlined in Table 1.3 best reveals the physiology of a structure? And which medical imaging technique would you use to determine whether the bone was being broken? Now we are on the last portion of our lesson. Before we end, I have presented here some of the critical thinking questions that will help you exercise your thinking abilities. And these questions are not just simple questions. These are open-ended questions that are very essential in learning human anatomy and physiology. These are questions that requires you to think deeply, and it's more of a real life case scenarios that are being used in the field. The first question example for these critical thinking questions: an 8-year-old Raya was going for this record for the longest upside down hang from the monkey bars. She didn't make it, and she may have done extensive damage to her entire upper limb. The emergency room technician would like an x-ray film of her arm in the anatomical position. Use the proper anatomical terms to describe the position of Raya's arm, forearm, and hand in the x-ray. Very good. On the x-ray, the bone or the humerus of the arm, the brachium, would be located most proximal. The two bones of the forearm, the antebrachium, the ulna, and the radius would be located distal to the humerus, with the ulna situated medial to the radius. And in the hand, 15 phalanges would comprise the distal fingers, while the 5 metacarpals would be found in the more proximal palm. Distal to the ulna and the radius, and proximal to the metacarpals, the wrist would be comprised of 8 carpal bones. Nice try. Next question. An alien landed in your backyard, abducted your cat, and flew off. Being an observant student of anatomy, you later described the alien's appearance to the NBA as follows. It has it had two caudal extensions, six bilateral extremities, four axilla, and one oral orifice in place of an umbilicus. What did the alien look like? Very good. The alien would have two tails, four arms, two legs, and a mouth where the navel is usually located. Next, your anatomy professor displays an MRI scan that shows a parasagittal section of the torso taken through the midpoint of the left mammary gland. Name five organs you would expect to see in this image. You may consult a general photo of the human body. Very good. Your lung, diaphragm, your stomach, large intestine, small intestine, possibly part of pancreas, ovary, or uterine tube, and the kidneys. And last question. McKissick has been diagnosed with a ruptured appendix, which has allowed bacteria from his intestinal tract to infect his peritoneum. The doctors are very concerned. Why do you consider this condition, peritonitis, to be so dangerous? Again, why do they consider this condition, peritonitis, to be so dangerous? Very good. The peritoneum, the largest serous membrane in your body, covers most of the organs of your abdominal cavity. Therefore, an infection in this structure can spread to any or all of the organs in that cavity. Wonderful. Thank you so much for listening, and I hope that you've learned something from our discussion today. This is again an introduction to the human body, and this is Steven. Keep safe. Thank you.